Good afternoon, and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each Wednesday at noon for this update, which is number 84. This year, PAC TV was awarded Business of the Year from the Plymouth Area Chamber of Commerce, and this was done this past Friday. PAC TV has been tireless in its efforts to support the towns that it serves over the past year. These COVID-19 updates are a perfect example as we're on our 84th show today. Congratulations to PAC TV, and thanks to all of you for all you do for the community. This forum is being brought to you live by PAC TV on Comcast channels 15 and Verizon channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants joining Representative Matthew Muratore and me include Dr. Philip Triffletti, Dr. Mark Wilson, Melissa Arrighi, Plymouth Town Manager, also Plymouth County District Attorney Timothy Cruz. We're welcoming Michelle Bratti. She is Director of Elder Affairs for the town of Plymouth. Michael Jackman, District Director from Congressman William Keating's office, and Amy Naples, the Executive Director, Plymouth Area Chamber of Commerce. We're going to begin with our opening welcome from Plymouth State Representative Matthew Muratore. Welcome, Matt.
Hey, Steve, how you doing today? And yes, I want to throw in my congratulations to PAC TV and Julie Thompson and her leadership. And we've talked about it on the show before. It's inspiring of what they have done during this pandemic when everyone else was kind of running away from things and saying no to things. Julie and the team were just saying, yes, how can we help? How can we do it? And they just have gone above and beyond and have really shown why, mass access and all these access channels throughout the Commonwealth and throughout the country, how important they are. And in particular to the climate that we're in as well, where, you're trying to get trusted information. And Steve, you and I have talked about this before. This is trusted information. We look at the people that are on this panel today and every week that we do this. This is trusted information that you're getting right in your backyard. So again, applause to and thank you to Julie and PAC TV. Steve, I just want to go over quickly some numbers and just briefly talk about the vaccine before we get to our guests. So as you know, this is the 1-year anniversary of the first COVID case, which was on February 1st of last year. So it's hard to believe that it's been a year now. All told, there is over 502,000 cases that have been confirmed in that year of COVID cases. When you look at recently, though, the cases have dropped below 2,000 for the first time since November. There were 1,963 cases yesterday. So we are below 2,000 for the first time since November. The 7-day positivity rate has dropped as well. We're at 3.44%, which is on January 1st, we were at 8.7%. So that's a dramatic drop. 67,000 people have been confirmed with active cases as we speak. That has dropped from a high as almost 100,000 a few weeks ago. The deaths are still high at 14,652 deaths with the average age of 80. And that's going to be important in 1 minute when I talk about the vaccine usage. In the hospitals have dropped as well. Hospitalizations have dropped. There's a little over 1,600 in the hospital throughout the Commonwealth at this point, with a little over 350 in ICUs and a little over 220 that are intubated. And those are lows from January 1st. And January 1st, we had 2,400 folks that were in the hospital. So in less than a month, we've dropped that by about 800. So things are trending in the right direction. With regard to the vaccine, as you know, Steve, the governor came down, Lieutenant Governor, Secretary Keneally came down to Plymouth on Thursday, and it was a tough day because there was a lot of issues with the website last week, and the governor knew it, acknowledged it, and there's some changes that are going to be happening. There'll be a call center that will be opening as early as this week, particularly for seniors, because the phase that we're in now is phase 2, with seniors over 75 and older being able to get vaccinated. So the call center will be up and running shortly. I know Michelle is on today. I'm sure she'll talk about this too. But if you need help, the Center for Active Living will be able to help folks as well. Old Colony Elder Services will be able to help, as well as our office as well for folks that may need that. But this is really a supply and demand issue, and I've been spending a number of days talking about this with so many different people. They're having trouble getting appointments. We have about 1 million people in this category that are looking for vaccines, and we're receiving somewhere between 80 and 100,000 doses every week, which is usually on Thursday. So Thursdays are the best day for folks to go on the website to start making appointments, because once we know the amount we're getting in the Commonwealth, then it can start getting allocated out, and the sites will know how much they're getting and how many appointments they can do. So when you're looking at 1 million people looking for a vaccine, first vaccine, not the second vaccine, the first vaccine, and you only have 80 to 100,000, I mean, you could do the math on that. So we hope, though, that with production of vaccine beefing up in this country over the next several weeks, that we'll be seeing more. Right now, we have 103 sites that give vaccines in the Commonwealth. That's going to go up to 165 by the middle to the latter part of February. I know Melissa's going to talk a little bit about a potential site in our area and what's happening in our area. Right now, there are 5 massive sites that are in the Commonwealth. Gillette Stadium, Fenway Park probably being the closest to us at this point, but they're up and running. Pharmacies, there's a federal retail pharmacy program that is receiving doses as well. And more will be added to that starting next week. So you'll see pharmacies that will be being able to do this. But again, there's smaller amounts of doses that they're going to receive, but you'll be able to go to a pharmacy, not all of them, but pharmacies on the map. I know the website that we keep posting on there is mass.gov/COVID-19 vaccine. And that's an important map site for people to go to, so you can actually see where the locations are near you at this point. But keep in mind, that's going to be changing over the next couple of weeks. Right now in the Commonwealth, we have received from the federal government a little over 1 million vaccines. And this was as of the weekend, 625,000 folks have been vaccinated. And that's about almost 6% of the population of the Commonwealth has been vaccinated with one vaccine, and a little over 1% has had 2 vaccines. There's also what else the governor put into place last week too, is there's been some of the vaccination sites have been holding back on vaccines a little bit. But what the governor has done now at this point is, if you're holding back, they want you to start distributing as much as you have, and you'll be able to get your doses the following week. There was a little issue whether places were going to get vaccines the following week, so they were holding back a little bit. But now they're able to give that out. So you'll be able to see more vaccines being given out shortly. So that is a quick update from the state perspective, Steve, and I look forward to hearing from the rest of our panelists.
Thank you, and that's Plymouth State Representative Matthew Muratore. Each week we're normally joined by Select Board Chair Kenneth DeVaris, but he asked me to report that speaking of vaccines, he's joined me as a local official that has received a vaccine. He's receiving his right now as we speak. And at this time, we're going to go to our medical segment, and we welcome back Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve, and good afternoon. Appreciate being on the program again for your broadcast. Thanks. So I'm going to start with just talking about what's going on with infections, just think about what's going on worldwide, nationally, and then, of course, you've heard some of the statistics already from Matt about what's happening here in Massachusetts. But right now, we've had worldwide 104 million infections that have been recorded and 2.2 million deaths worldwide. And I'm sure those numbers are underreported. I think, in some countries we do a better job reporting than others. At the number of cases that we're now seeing per day worldwide is about 500,000 or 500,000 cases per day. And this seems to be down a little bit from the peak of several weeks ago when it was about 700,000 cases per day. So what we're seeing nationally here, what we're seeing in Massachusetts, very much mirrors what's happening worldwide. Partly because we do represent a significant proportion, but the trends are similar worldwide to what's happening here. What you'll see when you have infections and then hospitalizations lag behind that and deaths, we're still seeing some peak rates of death, here in the Commonwealth as well as, nationally. And these death rates may decline, lag behind the slower rates of infection. One country I thought that would be interesting to look at actually was what's happening in the United Kingdom right now. They've had a pretty dramatic drop in their infection rates over the last several weeks. I think they put in quite a bit of lockdown, but they've still seen quite an increased number of deaths. And I know they're very worried about what's happening with that variant in their community, where that's accounting for a large proportion now of their infection. So obviously we have the variant, which you'll hear a little bit about in the broadcast today, and we'll continue to learn more and more about UK variant and other variants, how they're affecting things. But yeah, in the UK they're seeing reduced numbers of infection, probably due to their mitigation strategies, but they're still seeing somewhat high death rates. So we'll have to watch their death rate and see what happens there. And Dr. Fauci, you may have noticed in the past several days, has been saying that he does believe that in the United States we'll probably have that UK variant may be the predominant variant here sometime in the month of March. And what happens with these more contagious variants is they're much more effective at spreading since they're more contagious, and then eventually you see the more contagious strains will sort of push aside the less contagious strains, so you have more of those. Right now, as you probably know, our surveillance programs here in the United States have only showed very small numbers of the variants here, but we do know it's here. It's estimated that these variants are maybe 25 to 40% more contagious or infectious, and I think it's still to be known whether they're more deadly, but there is a possibility that they may also be more deadly. Dr. Fauci has predicted another potential surge here in the United States based on having this more contagious variant be here in the upcoming months. So, I think it just reinforces, when we talk about all the things we need to be doing. Obviously, we're doing the best we can to get people vaccines, but we will review those other mitigation strategies like mask wearing, et cetera. I still think that's a critical piece of how we're going to control and prevent surges. Matt covered what's going on with vaccine supply very well here in the state. I like to point out to a lot of my patients, because I often hear from patients, I knew somebody in this state that got vaccine, and each state is different. So we don't have a universal federal program for administering the vaccine. So you will see differences from state to state. And also, I wanted to point out that when we get into the part 2 of phase 2 right now, we're vaccinating those over 75, but next we'll be doing those over 65. Hopefully that will be in a matter of a few weeks, as Matt was going through some of the numbers, in the number of people we need to get vaccinated before we can move on, to the next part of phase 2. In the United States, just thinking of how we're doing, compared to other countries, right now we have vaccinated about 8% of our U.S. population. In the United Kingdom, they've vaccinated about 14%. You may have heard in Israel, they're up around 30%. So, when you can compare different countries, we don't have a single national healthcare system like the UK and some of the other countries have some advantages. We're a much more decentralized system. We have multiple insurance companies, multiple healthcare providers that aren't linked together into one national system. So we believe that's one of the factors that's affecting, how fast we can get our vaccination programs performed. Now, I did want to mention also, this morning I went on the mass.gov COVID-19 vaccine website just to see how it was working. And, there were a couple sites listed for the Plymouth area. In Kingston, there was Skin of Steam and there was Big Y. And I was unable to book an appointment. I was trying to see because they were full or not booking at this time. But, like Matt had mentioned, Thursday, the appointments are released on a rolling basis each week. And so Thursday is the big day. So probably after midnight tonight, people could go online and hopefully, start to make more appointments. I think we just have to continue to be frank about our circumstances. We just don't have enough vaccine right now. The vaccine is scarce. So, we have to do the best we can, each of us, to be patient about receiving this vaccine. But I am confident that our manufacturers will continue to bolster the supply, and you'll start to see more and more vaccine getting out to each state. And we'll get through this, but it is unfortunately, going to take some time for us to get to everyone. Just a little bit of information about the vaccine. Probably many of you know that if you're taking a 2-dose vaccine, which are the only 2 that we now have available, you're maybe 50% protected after the first dose, and after the second dose, protection goes way up to approximately 95%. And it's about 7 days or so after you've had your second vaccine when you reach that maximum protection. So that's what you should expect in terms of the protection. There was a news item this morning about the AstraZeneca, again, showing that the vaccine looks like it can, in the majority of patients, prevent viral shedding and infection. So that's more information we keep getting, that it looks like, while it's not going to be 100% protection against getting an infection once you've had a vaccine, most people will probably not get infected. And we don't have studies yet to know those that do get infected that have had vaccine, how contagious they will be. But those studies will be forthcoming, in the future weeks and months. I want to continue just to emphasize, how important it is to use masks, social distancing, really until we get our community spread numbers way down. We're going to have to continue to use all these strategies, public health strategies, until we get to herd immunity. Basically, we'll still be using, I think, those public health strategies. So, hope maybe later this year, we'll get there, but we've got a ways to go still until we get to herd immunity. In terms of what happens after you've been vaccinated, at this point, we believe that if you get exposed to the variants and you've been vaccinated, that it's likely that you'll still be very well protected from severe disease. And so, we'll be watching this very closely. I think, over the months to come, that's going to be probably the most key indicator about what's probably going to happen with our vaccine programs is, protection from severe disease. But at this point, it appears that the vaccines do prevent against severe disease. On the other hand, natural immunity, those people who got infected but have not had the vaccine, when looking at some information from in Brazil, there's a part of the country there called Manaus, where they look to be having a second major surge of infections with the variant, the Brazil variant. And it looks like the people got infected the first time around with the more common variant were susceptible to infection with the second variant. So that will be a concern going forward. We believe that there may be different reasons why people might get reinfected. It could be that the antibody levels from a natural infection don't last as long, or it could be that the new virus variant is more adept at avoiding the antibodies from the first infection. We don't know the answers to that yet, but we do believe that the vaccines will provide better protection than natural immunity. So this is still, our great hope, pushing ahead with our vaccine programs, here in the United States and elsewhere across the globe. So I don't want to take up too much time, but there's many more things that can be discussed, and I'll save some of them for the end when we have questions. But Thanks again, Steve, for having me on today, and I look forward to talking at the end of the program. Thanks.
Thank you, Dr. Philip Triffletti. You can send your questions to PlymouthInfo@pactv.org. And at this time, we welcome back Dr. Mark Wilson. He is from the Department of Epidemiology at University of Michigan. Welcome, Mark.
Thanks very much, Steve. Today, what I'd like to do is actually a nice follow-on to what Dr. Triffletti just spoke about with regard to vaccination, and share with you some new information and maybe some insights into what some of these terms might mean and how we can interpret them. And this might be helpful to the viewers who are listening today. There's been quite a bit of discussion, of course, lately about the potential problems with the new COVID vaccines, including issues of distribution, this less than 100% efficacy, the new variants and so forth, as was just mentioned. But I think it's important that we keep in mind the extraordinarily positive impacts and disease prevention promise that these vaccines have given us. First, let's remember that results from clinical trials of all 5 vaccine producers show that each vaccine has drastically reduced hospitalizations and essentially eliminated COVID-19 deaths. And while the percentages may depend on the people studied, the location, the follow-up time, and so forth, all of these vaccines have shown exceptionally good results. And so I guess what I'm arguing for here is that we focus not on the relatively minor differences among the vaccine results, because that may lead us to incorrectly assume that some vaccines are ineffective. And even though the results are still being released, virtually all of what we know about each vaccine is extremely encouraging, and it includes how they respond to these emerging virus variants. There's still a lot to learn about that, but most of what is appearing now is quite promising. So part of the confusion might actually come from what we mean when we say a vaccine is effective. Effectiveness has to be defined with regard to what has been improved, to how much of an impact was seen, to who has been affected, and for how long the benefits last. And because some clinical trials ended only a few months ago, we don't really know just how long vaccine protection will last. As for who is benefiting, protection is going to be different based on each person's age, genetics, other diseases, and many other characteristics. And so this is why clinical trials need such a large diversity of participants. And it's also why comprehensive statistical analyses are needed to understand the effectiveness of each of the different groups of people. As for how much of an impact a vaccine has, this is usually measured by a smaller number or a lower percentage of disease events for the vaccinated versus the non-vaccinated. However, here again, there are many different measures for comparing such differences. And finally, the question of what the vaccine is reducing is important. And this can include less infection, fewer symptoms, less severe disease, a lower rate of hospitalization, or fewer deaths. So the outcome that gets reported could make a vaccine appear either very effective or only moderately effective. Each of these measures of how good a vaccine is doing gives us sort of different kinds of information, but they are all useful, even if a bit confusing at times. But the bottom line is that each of the vaccines has undergone rigorous clinical trial testing and proven to be safe and effective. So each vaccine is able to decrease the amount of infection and disease. By comparison, let's remember that during, for example, last year's influenza season, which was considered to be fairly moderate, 38 million people were sick with the flu, 400,000 were hospitalized, and there were 22,000 influenza deaths in the United States. So even though we're unlikely to completely eliminate all COVID disease and deaths, vaccination, along with our own prevention behaviors, is going to have a huge impact on the pandemic in the very near future. So now I'd like to address another question that's related to vaccine effectiveness, which is the following. If it is reported that a vaccine is 90% effective, does that mean I have a 10% risk of being infected? And the answer is, well, not exactly. First of all, remember that these numbers come from studying large and diverse groups of people, some of whom were vaccinated, some of whom were not. So it's impossible to describe the risk of any individual person, you or me, based on a study involving many different people with lots of different characteristics. So in other words, the risk to many people in a population cannot be transferred to that for any one individual. Many components of risk contribute to the overall risk that an individual experiences. So for example, if you have certain pre-existing conditions, or if your individual risk would be higher than that that's calculated for the population. Similarly, if you had if you're a COVID-19 hospital worker, for example, your risk would be greater than if you only worked from home and occasionally went out just for food shopping. However, the population level risk does give us an idea of what risk is on average. So related to this is another question, and it goes as follows. I've heard the terms effectiveness and efficacy being used and wonder if they are the same, and just what do they mean? So they're related, but they are not important. There are important differences. They are not the same. Efficacy is what's measured in a clinical trial. So if it's reported, for example, that the Pfizer vaccine had 95% efficacy in preventing symptoms, this means that 95% fewer vaccinated people in that trial had symptoms. So these clinical trials are intended to be as similar as possible to the real world. And even though they involve thousands of participants, there are efforts made to try to represent as best as possible the diversity of people in the larger population. These are really not real world tests of the vaccine. Once the vaccine has been approved for public use, effectiveness is what we measure with the millions of people across the whole US who are now being vaccinated, indeed across the whole world. And this is different than a smaller clinical trial where, for example, pregnant women were not included, or there might be proportionally fewer minorities involved, or there might be underlying health conditions that weren't well represented, and so forth. So the clinical trial population is not exactly the same as the real world population, and yet that does still give us insights, information into what the risk might actually be to you or me. The real world effectiveness may be a bit more or less than the vaccine trial efficacy, but the results are generally similar. And again, everything we see so far is extremely positive. So finally, I'd like to present some questions and answers about COVID vaccines that I gathered from the CDC website just yesterday. I thought these might be useful and informative to listeners. The website is one that anyone can look up. It's cdc.gov, G-O-V, and /vaccines. Again, cdc.gov/vaccines. The first question is, how do I know which sources of COVID-19 vaccination information are accurate? So for sure, it can be really difficult to know where to get information that you can trust. The CDC has created a summary of credible sources for vaccine information on its website, and among them are the WHO Vaccine Safety Net, the Global Advisory Committee on Vaccine Safety, and many others. And I just encourage you to take a look at that website, where you'll find a whole lot more information on these reliable sources. Next question. Can a COVID vaccine make me sick with COVID? And the answer is simply and emphatically no. None of the authorized and recommended COVID vaccines, nor any that are currently being developed in the US, contain the live virus that causes COVID. This means that the vaccine cannot make you sick with COVID. The CDC website has a whole lot more information on the types of vaccines and how they work. And again, I encourage any of you who are interested to look at that website. Next question is, after getting a COVID-19 vaccine, will I test positive for the virus? And again, the answer is no. Neither these recently authorized vaccines nor any of the others that are currently undergoing clinical trials can cause you to be positive on virus tests. These tests are designed to indicate if you have current infection, but you won't be positive if you have been vaccinated. You may test positive on some antibody tests after the vaccination. Indeed, we hope that one would, because you've developed an immune response. And these antibody tests then either are positive for previous infection or for an immune response from vaccination. But you will not incorrectly test positive on the virus test following the vaccination. The next question is, if I've already had COVID-19 and recovered, do I need to get vaccinated? Again, the answer is yes. And this is because of the serious risks associated with COVID-19 and the possibility of being reinfected. You really should be vaccinated, even if you've already had COVID. There's still a fair amount of uncertainty about how long someone is protected from getting sick, as was just mentioned by Dr. Triffletti, after you've had COVID once. And so this natural immunity, it varies from person to person, and it may be a matter of a few months. It could be hopefully even years. But it's going to be some time before we'll be able to determine that. The next question is, will a COVID-19 vaccine alter my DNA? And the answer, again, definitely not. COVID-19 mRNA vaccines, these are the two that we currently have available in the United States right now, do not change or in any way interact with your own DNA. These are vaccine materials that essentially teach our cells how to make a protein that triggers the specific immune response. So there's no way that these can enter the nucleus of your cells, which is where your DNA is stored. And it means that they are really unable to affect in any way your own DNA. Finally, the question specifically for women, is it safe for me to get a COVID-19 vaccine if one day I would like to have a baby? Yes. Women who want to become pregnant in the future may receive the COVID-19 vaccine, and this is being carefully studied for side effects, but for the moment, there's really no indication at all that there are any side effects or any contraindications for women who are pregnant or intend to become pregnant in taking the COVID vaccine. There's no indication that there should be any fertility problems or any side effects, really, for any vaccine for that matter. And so women who are trying to become pregnant now or plan to be in the future may receive the COVID-19 vaccine when it becomes available to them. Again, this is all good news. Let me stop there, and I'd be happy to answer any questions at the end of the session today. Thanks.
Thank you. That is Dr. Mark Wilson. He is Professor Emeritus, University of Michigan School of Public Health. And at this time, we welcome back our Plymouth Town Manager, Melissa Arrighi. Welcome, Melissa.
Hi there, nice to see everybody. So some of the things that I would like to talk about is the latest efforts that we have going on the local level strictly in the town of Plymouth. The first is good news, and that is that we partnered with Brewster Ambulance and our local firefighters, efforts of so many people, but we were able to hold vaccination clinics for the 5 Plymouth Housing Authority locations. We didn't do a lot of publicity about that ahead of time. And I know that has some people concerned. Why not get that news out there? And the reason is, in talking to the Housing Authority, we did have some concerns that residents may think they could show up at the site and get vaccinated, and that was not the case. We were doing a trial run in some ways, we can word it that way, to target specifically those that congregate housing, those 5 location settings, and we're able to do 100 vaccinations yesterday. We plan on doing 150 today at the other locations. We had, I believe, 3 or 4 firefighters working, as well as a couple nurses from Brewster Ambulance and Chris DeBona, who's been a great partner at Brewster Ambulance. So it was successful. We think the Housing Authority is pleased. The Housing Authority staff was really helpful in this process. And it was a nice way to roll out what we eventually hope to do in some other locations in the community. In addition, we have worked with the state, and thank you, Representative Muratore, for your introduction to this, to establish a new testing facility site that's dedicated to early educators and their families. That is at 33 Lothrop Street. For many of us, that address doesn't make sense. It's really the old MBTA lot, which is next to the Hotel 1620. And, you know, it's difficult when you go on these shows. You want to thank so many people. This is such a huge partnership to do all of this. But the general manager at the hotel was wonderful, worked really well with Chief Bradley, who helped coordinate a lot of this effort, and so did Visit Healthcare. So with that cooperation with the state agencies, that could potentially be up and running today. Now, weather set us back a little bit. Our public works crews were on site this morning helping to set up the parking lot. I haven't been down there yet to see if that is all completed, but we do know that will be active soon. 4 days a week, rotating 2 days at a time from 11 a.m. to 7 p.m. And again, this is for early educators and their families. We are also looking to our senior center. Michelle Bratti, thank you. We've talked a lot lately about helping our seniors, those who are eligible for the vaccination, giving them some assistance to our social workers to help them navigate the state website to get the appointments. And we do hear all the time that there is frustration, but I have to tell you, the state's done a great job on that website. So if we can just be patient, this is early days in having the vaccination available. They have been successful in getting some of our seniors those appointments. They'll walk them through it while they're on their computer. In addition to that, if they have no computer access, they can assist them and actually try and do the appointment. Now, when I talk about our success rate with that, Michelle said there were maybe a handful of appointments they were able to do last week, but you know what? Every appointment counts. So we will keep at it, and we're there to help you in any way we can. And finally, there are 3 more areas that we're working on. In collaboration with our public health department, of course, and our Board of Health, Brewster Ambulance, the PFFM, which is the State Firefighters Association of Massachusetts, as well as our local firefighters and our town employees, we are looking to try and do a mobile vaccination unit sometime in the future that would target our homebound seniors and our homebound non-seniors. It would travel throughout the community on set days and times, and we would be able to go into the homes and vaccinate. This is a work in progress, so give us some time, but we are working on that now with Brewster Ambulance, and we do believe we will be able to roll that out. We also are looking to offer to the state and have other specific sites in our community for vaccination clinics. Typically, people think of the Center for Active Living, Memorial Hall. We even have the old school administration building on South Meadow Road, possibly the schools and a cafeteria. So we will make a facility available if we are so choosing to hold those local sites. So we are working on that. In addition, there is a regional effort by the state for a larger hub for a vaccination clinic somewhere on the Route 3 corridor. The Kingston Mall, or the old Kingston Mall, is being looked at very closely for that. The town administrator from Kingston, he's new, Keith Hickey. What a time to come into Kingston, but I hope to work with him closely. He has reached out to introduce himself, and a state delegation, Representative Muratore, Senator Morand, as well as the Kingston Board of Health, our Board of Health, even the property manager at the old Kingston Mall. Everybody is trying to pitch together to see if we can make this a reality. We need to do some work on our end, and I'm happy to partner with the Kingston Town Administrator to convince the state that we can do this at that site. So we will keep you informed if that indeed happens. And then finally, I'm kind of piggybacking on what Dr. Wilson said about questions and answers. I do a Q&A segment weekly in my town manager's report. And lately, I feel like so many of those questions are specifically about vaccinations. So please, if you haven't had a chance, for those people that are watching the show, will see this later. If they have not had a chance to go out to the town's website, take a look at the town manager's report or our Facebook page, just to hear a little bit more information about what we are working on and what is available to the residents right now.
Thank you, and that's Melissa Arrighi. She is Plymouth Town Manager. She'll be here to answer your questions. Send them to plymouthinfo@pactv.org. This time we welcome back Plymouth County District Attorney Timothy Cruz. and District Attorney Cruz, what is your office doing in response to the coronavirus?
Yeah, hi, Steve. It's great to be back talking to people in Plymouth. It's always really informative listening to everybody, and I'm glad that you have the opportunity to do that and talk a little bit about what's going on here in the DA's office and in the court system that is really, like every place, is just continues to be challenged. You know, as of January 8th of this year, in the interest of safety of the court staff, court users, and the public, the trial court departments are maintaining the current level of business and departmental standing orders really remaining as is until April 5th of this year. What that means is that the managers in the courts, as well as in my office, were capped at no more than 50% of staff working in a court department or any office at any time. So we continue to have the majority of the people in our office are working from home on a rotating basis when they have to come in or when they go to court. Because court is still ongoing. And even with all the important things that everybody's talking about and the issues that are going on, we're trying to maintain the cases as they come in because crime doesn't stop, much like many things don't stop during COVID-19. So phase one of the resumption of jury trials got going in January 11th, I think it was the date, for 6-person jury trials at only designated locations and designated courthouses here in the Commonwealth. We did have a trial in Plymouth at that facility, which was great because it's such a newer facility and it allows us the opportunity to get the PPE and the things that need to be done in the trial courts themselves. I think, as a matter of fact, I was informed that the first jury trial here in the Commonwealth during the pandemic was in Plymouth at that time. So we continue on. But, you know, while we're continuing to deal with all of our cases, our older cases, our newer cases, you know, we try to inventory, categorize, and prioritize the cases so that when the curtain eventually comes up, and it will come up. I mean, we will be dealing with lots of different cases. We're trying to have a jury readiness inventory so that we can determine what cases need to go. And like I said, I think we're very lucky to have the Plymouth District Court, Superior Court. It's such a beautiful facility. So we're going to continue to do remote trainings, curriculum to help everybody involved in the court system, whether it be the registrars, the clerks, the magistrates, and trying to get back to as normal as we can. One of the other issues that we're dealing with, unfortunately, beyond the fact that we continue to deal with the issues with opioid overdoses here in our county, but we're also dealing with really a level of scams that we haven't seen yet. And when we talk of scams that are going on in our community, we continue to talk of scams against seniors, scams against individuals who are really, you know, at home now. They're shut in now, a lot of them, and they're in a position whereby people are reaching out to them through text messages, through phone messages. And there's been a significant increase in the numbers of scams and cybercrimes, a lot of it related to misinformation as pertains to COVID-19. The scammers that are out there are once again taking advantage of people who are unsuspecting, who are trusting. And in this time that we have to focus so hard on staying vigilant regarding being healthy and being safe, we also have to be just as equally vigilant regarding the information, the people that we deal with online. Because there are people that are out there that are taking advantage of our seniors and everyone else. And like I said, there's kind of a COVID twist to it now because these scammers stay on top of these issues. So you've all heard of, you know, the grandparent scams that have been going on for a period of time. We had a case here in our county, unfortunately, a few months back where a grandparent was asleep in bed. You get that phone call at night. We all know that, you know, phone calls at night are never a good thing. It startles you, it wakes you up, and then somebody's on the phone and somebody's saying to you, Grandma, help me, I just got arrested. Or in this instance, they said, this individual alleged to be a grandparent. Once they said, I just got arrested, they said, Johnny, is that you? And that's the next step for these scam artists once they get the name. Because everybody says, well, I would know my grandson or my granddaughter if they call me up. I would know what they sound like. I'm not, not going to be able to tell that. But in the situation where you are startled, when you are called in the middle of the night, when the individual, once you say that name, you give them a way in. And then they'll say, Johnny will say to you, oh, I'm here with my friend's dad. He's a lawyer. Talk to him. And now you're talking to one of the scam artists. And what we had in that instance was, this is back in April or May, the beginning of COVID. The individual stated that he was with his buddy up in New Hampshire, got into a car accident. Somebody got hurt. And as a result of that, he was facing criminal charges. But because of COVID, the courts were closed. They were only opening the courts one day a week. And that they didn't come up with $8,000 cash, he was going to be held for a week. So they developed this conversation, numbers of phone calls throughout the day, scare the seniors, so that this woman actually went to her bank and withdrew $8,000 cash. And the scam goes on, and what eventually happened was they showed up at this woman's house later on in the afternoon, masked because of COVID. And this woman went down to the end of her driveway and gave $8,000 cash to these individuals. And then they told her, your grandson will be back in touch with you. He'll be released shortly. Just wait by your phone. She waited, a couple of hours, didn't hear from anybody. Eventually she reached out, well, like she should have done earlier. I reached out and found out that her grandson, nothing had happened to him, and that this was a complete scam. Now, normally speaking, the reason why it's so important to let people know about these things is that it's very difficult to catch people in this instances. In this case, actually, the state police assigned to my office, working with the Hanover police that occurred in Hanover, they actually made an arrest out of this. And now an individual is facing charges as a result of this, and that's a great thing. But we all need to remember and understand that most times when you put money out there, and notwithstanding a lot of great training at our supermarkets, at our banks, when a senior comes in and makes an unusual request and they're going to be asked, are you okay? Is something going on? In this instance, the woman said, I'm okay. And unfortunately, she was scared for her grandson. So whatever the scam is, I've been arrested. I'm in a hospital. I don't have any money to pay for the COVID treatment that I'm getting. Remember that, people are out there and they're really good at what they do. And what they do is talk you out of your money. There are numbers of other fraudulent scams going on now pertaining to contact tracing, fraudulent billing of Medicare for COVID-19. Scammers are calling people up or they're texting people saying that you've been in close proximity to somebody who tested positive for COVID-19. Therefore, you have to self-isolate and take a COVID-19 test. When the person asks me, the first thing I would ask is, well, who was I near? And they'll say, well, because of HIPAA, we can't tell you what that is. We can't tell you who that person is. It's confidential. And then they'll say, you need to be tested in 72 hours, but you need to make a $50 payment off your credit card. And the scammer then pressures the victim to come up with their credit card numbers. And when they push back and say there shouldn't be a fee, they threaten the victim with penalties for not complying. Now, remember, a few months back, the Massachusetts Senior Medicare Patrol Program sent an alert to seniors never to accept any form of COVID-19 testing from anybody other than a treating licensed physician or from a state-designated testing site. Scammers are going door to door, believe it or not, and they're actually giving a fake test, saying you have a false positive, will treat you immediately, and taking your information from Medicare. They're actually billing Medicare, some of these guys, are going around with your information that you give up because you're concerned. So remember, these legitimate people aren't going door to door. Social Security scams, people are calling up, continue to say they work for the Social Security Administration, and basically they'll send you emails. They're phishing for individuals at that point. They're trying to make sure that they can get your information. They're trying to get you when you're unsuspecting. And we need to make sure that we continue to safeguard our credit card numbers, our bank informations. Bank is a bank or a credit card company that you're dealing with. They've already got your information. They don't need it. Don't give it to them. It's unfortunately and remains to be a scam. And it's much like when we dealt with the IRS scam a few months back, when the IRS called you up. We all got these calls threatening you. You're going to be arrested. You're going to be arrested if you don't do this. If you don't do this, legitimate government, state agencies are not going to be threatening you with that. And the joke I always tell is, I said, a big secret in law enforcement is that when the police are going to come and arrest you, they never call you first. They just come and arrest you. So when these people are threatening you with that, you should know that. So remember, if it happens to you, if you get scammed, we got to reach out to our local police, our federal brothers and sisters of law enforcement. We need to get the word out there so other people understand it. I know people are sometimes embarrassed by it, that they were caught up in this. But you should always remember that there's a reason why these people focus on this grandparent scam or whatever the scam may be, and that's because they're really successful at it and they're really good at it, and they can talk you out of your information. So let's continue to make sure that we get the word out to everybody. If you have any questions or thoughts as regard, or you need phone numbers for anything as pertains to Better Business Bureau or any of these agencies you may hear about today, please go on PlymouthDA.com. We have all sorts of information, and if we don't have it, we can get you where you need to go. So thanks for the opportunity of speaking today, and hopefully we can keep the dialogue open and keep everybody informed and safe, and we'll be through this COVID thing sooner rather than later. Thank you.
Thank you, Timothy Cruz. He is the Plymouth County District Attorney. He has great information for seniors, which leads us right to Michelle Bratti, Director of Elder Affairs for the town of Plymouth. Welcome, Michelle.
Hi, Steve and everyone. Thank you so much. Congratulations, PAC TV. So well deserved. Julie and the staff have my utmost respect for all they've done for Cal and the community. As Melissa had mentioned, I just want to talk a little bit about seniors. The best website to schedule an appointment is www.mass.gov/COVID-19-vaccine. We'll get that to you if you need it. We'll have all the information you need. I'm really excited by the news that Melissa shared regarding the senior housing units and potential future rolling vaccinations for homebound seniors. Accessing appointments has been challenging, but we will get there, seniors. Please know, while more vaccines come into the state every week, vaccine supply is still very limited. It may take several weeks to get an appointment. Remember that this is only the beginning of phase 2, which lasts technically through the end of April, and phase 1 has not been completed yet. A few tips. Thursdays may be the best days to look for new openings at mass vaccination locations. For smaller locations, like pharmacies, websites may be checked more frequently. I'll give you a tip. CVS in Hanover, for example, usually opens their appointments at the stroke of midnight. True story, I've made one for a senior. Most appointments require the following: personal information. You're filling out your name, address, date of birth, and the like with an email address. Health insurance information, consent form or attestation. That's what you're going to hear a lot, that word. It's a consent. And medical and screening questions. Remember, you don't need insurance to receive a vaccine. Nobody should be asking you for payment information. There may be a wait upon arrival at your vaccination location. You should bring assistive devices such as wheelchairs or walkers or other supports you need. You will be asked to stay for 15 minutes after your vaccine to monitor for side effects. You should contact your primary care physician if you experience side effects at home or have other health concerns after your vaccine. You will receive a card after your first vaccine with your brand information on it and when the next dose is due. Before leaving your location, you should schedule, confirm, or find out next steps for scheduling your second dose. Make sure you have a copy of the information. If you are receiving care through the Veterans Administration, the VA, you can contact your local VA location. They will help you get appointments. I think that's really important for veterans to know. As Matt mentioned, the Commonwealth is in the process of working on a state call center for scheduling appointments for those who do not have or cannot access online platforms, and we'll share that information with you as soon as it's available. As Attorney Cruz mentioned, unfortunately, you do need to be aware that there are now vaccination appointment scam websites already up and running. Double check your websites that they match the mass.gov site word for word. Sometimes these scammers just add an S at the end, or it looks just one letter or number off. In addition, if you receive a call from an unrecognizable source that offers help to schedule an appointment, under no circumstances should you provide them with the Social Security number or credit card. Again, no credit cards needed. We're getting many calls at Cal asking for assistance with the online vaccine registration process. Cal social workers are here to assist those that need help navigating the website or help register those that do not have access to a computer. Just please know there are very few vaccination site appointments being scheduled at this time, as the current supply just simply is not equal to the demand. Our staff check daily for updated information from the state and for new vaccination sites that the state approves. Please also recognize that despite the calendar saying February 3rd today, phase 2 just began. It's not completed. It's not, supply and demand is not equal. Seniors, you will be vaccinated. Please don't panic or worry that you will be left behind or forgotten. It's simply going to require patience and time. Remember, phase 2 is supposed to run from February 1st through the end of April. Know that we're here for you, and just as we have with the pandemic, we will walk beside you in the vaccination process until it's completed, regardless of the frustrations we face and the time that it takes. Call us, we're here. Thanks, Steve.
Thank you, Michelle Bratti. She is Director of Elder Affairs. At this time, we're going to go to Michael Jackman. He is District Director for Congressman William Keating. Welcome, Mike.
Thank you, Steve, and thank you to PAC TV, as always, to having the opportunity to come on and speak with you. And congratulations to PAC TV on a very well-deserved award. Been a lot of talk about vaccines, and very rightly, as Michelle just said, it is a supply and demand issue. And it's very important that the supply be increased as much as possible, which is why I'm happy to say that the Biden administration announced yesterday that they will be increasing supply. In addition to the federal retail pharmacy program that Matt referred to, they are also committed to increasing supply to 10.5 million doses a week, which is directly to the states, territories, and tribes, separate from the the pharmacy program. And that should be starting next week. And that's a 22% increase from January 20th. So very excited about that. Other announcement coming from the administration is that FEMA will be retroactively fully funding public assistance claims by the states and towns through the state back to January 2020. So the president had announced early on, early days of his administration, that going forward, reimbursements would be at 100%. And now they are saying that reimbursements retroactive back to January 2020 will also be fully funded too. So we're excited about that. There was an announcement just today that FEMA had awarded $213 million to MEMA, the Mass Emergency Management Agency. And some of that funding will be going to towns like Plymouth and surrounding towns in our district who have or are planning to submit reimbursement requests. So that's the news from the administration in terms of funding. There is, of course, the American Rescue Plan, which I'm sure anyone who's watched the news or read a newspaper in the last few days, there's a lot of back and forth between the House and the Senate and the administration about what that figure should be. It looks like the Senate is plowing ahead with a lot higher number, which the House, I think, would support. So we'll have to see what happens with that. And that leads me to my next point, which is that it is tax season. Tax season just starting. I know Heather's not here today. I'm sure she'd have a lot to say about it next time she's on the program. But one thing that we're seeing with the tax season this year is questions about the economic impact payment or the stimulus check, as more commonly known. Talked about it a lot. So, the 84 shows, or however many I've been on, or Heather's been on, or anyone's been on. But the thing to remember, if you were eligible for a stimulus payment, the economic impact payment, whether it was round one, the $1,200 payment, or round two, which just started last month, the $600 payment, if you were eligible and you did not receive it, you can claim it as a rebate recovery credit when you file your 2020 tax return. It's line 30 on your 1040, the new 1040 form. And people should definitely look out for that if they have not received the economic impact payment, either round 1 or 2, and believe they were eligible for it due to their adjusted gross income. You can always, as always, give our office a call about that. Our number is 508-746-9000. If you have questions or wondering why you didn't receive a payment, one thing I should note about the second round of the economic impact payment, the checks went out, checks and direct deposits and some debit cards went out in January. Some of the checks are still en route. If you got a check for your round 1 payment, the $1,200, it's very likely you'll be getting a check for round 2, and that might still be en route and on its way to you. If you got a direct deposit for round 1, you should have already gotten a direct deposit for round 2. There's all kinds of different stipulations about when you filed your 2019 tax return that is impacting people. The bottom line is if you qualified for it, if you were eligible for it and you did not receive it, you can claim it on your tax return when you file your 2020 taxes over the next few months. So I think I'll leave it there. But again, happy to have the opportunity to provide some information. People can, as always, feel free to give us a call, and looking forward to any questions people might have. Thank you, Steve.
Thank you, Michael Jackman. At this time, we're going to go to our business segment. Amy Naples, Executive Director of Plymouth Area Chamber of Commerce. Welcome, Amy.
Hi, Steve. Great to see you and all my fellow panelists today. Wow, such great information being shared. So as you all know, last Friday, the Chamber held its annual meeting right here on PAC TV. So first and foremost, I have a huge thank you in order for the tremendous support PAC TV lent to make that possible. It was a great day for the Chamber and an opportunity for all of us to showcase how great of a year we had despite the challenges in the pandemic, and that it was a great success for the Chamber and an investment for our local businesses. The event highlighted 2020, of course, initiatives for the coming year, gave praise to our board of directors and staff who also worked very hard to ensure that we continued our mission and goals to support our business community in every possible way. We also welcome 3 new board members, Amy Belmore from Habitat for Humanity, Stephen Cole, and as you all know, Stephen as another panelist from Plymouth Regional Economic Development Foundation, and Vinnie DiMacedo, which I'm sure most of you all know is past senator from Bridgewater State University. Not only was it a great day for the Chamber, but it was an opportunity for us to recognize 3 outstanding businesses who just simply were incredible this year. So in every possible sense. So our Ambassador of the Year award went to Pam Smith, who is a small business owner of Locally Yours, as well as Creative Pair Marketing. Pam has gone above and beyond for the Chamber with helping us with mentoring new members and membership recruitment and just engagement in general. She's just a wonderful person. If you all don't know her, definitely pop into her store and visit her because she's just so great. The Vinnie DiMacedo Grant Award, which was the first this year, as you know, at our last year's annual meeting, decided to recognize Vinnie for his tremendous work and the impact he had on our community as a whole, was presented to Jordan Shabbat of Speedwell Tavern for his leadership, his energized spirit. If you all know Jordan, he is just a spitfire and has so much energy, and he's an inspiration to all business owners. So it was so great to be able to that grant, which is a $5,000 grant. And we know as a restaurant owner, he could certainly use the help. And as Steve said, the Business of the Year award was given to PAC TV for their outstanding leadership in playing such a vital role in keeping our community informed and up to date on the pandemic. PAC TV has lent a hand in providing virtual events as well for nonprofits, including very important fundraisers, not just for the Chamber like Coachella, but also for the Plymouth Philharmonic Orchestra. They have honestly single-handedly helped us fundraise thousands and thousands of dollars. The entire team at PAC TV are true professionals, and of course, under the leadership of Julie Thompson, has worked tirelessly. Their passion for our community is just unmatched, and so isn't their creativity. So we are so lucky to have them, and a huge congratulations. I was so thrilled to be able to surprise Julie last Friday. And a quick update in regards to business relief banks are still processing PPP applications in those businesses impacted by the pandemic. The Town of Plymouth Community Development Office still also has grant funds available from the CARES Act, and I urge businesses with under 20 employees to review that grant application. You can go to the Town of Plymouth's website, community development page, and to see if you're eligible. I'm willing to help you with that application process. Certainly reach out to me anytime. Myself and my colleague Stephen Cole are always willing to lend a hand with any of those applications. And lastly, love is in the air and Valentine's Day is around the corner. And as you know, we are your go-to for gift guides, and Valentine's Day is no different. So be on the lookout for the Chamber's Valentine's Day gift guide, which will be dropped by the end of the week. All businesses showcased are local, and the listing is unique special gifts for her, him, galentines, pets, sweet treats, and all that good stuff. So be on the lookout. And that's our business update for today, Steve.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. We did receive a few questions from Lou and from Russ. I forwarded them to our panel. We're now going to go back through our panel for the closing statements. We're going to begin with Dr. Philip Triffletti. Phil, what's your takeaway today?
I just want to make two quick points. One is the federal government, President Biden put through a mask mandate for all public transportation. So that will be very, very helpful. Masks are very effective at preventing the spread of the infection. So that's an important point to keep in mind when you're traveling. Second, for Super Bowl parties, much like Christmas gatherings, Thanksgiving, we really would we would recommend only be with your immediate household. Don't let your mask down. And hope you all have a great day. Bye.
Thank you, Dr. Philip Triffletti, attending primary care physician, Beth Israel Deaconess. We're now going to go to Dr. Mark Wilson. Mark, lots of good information today. What should we remember?
Most everything we heard today was really good news. And this includes that we've started to vaccinate Plymouth residents, even though we're waiting for more doses and still ramping up the process. The vaccines are known to be safe and effective and will protect virtually everyone against severe disease. Local agencies and companies are cooperating in improving access to vaccination. There's assistance available to seniors and veterans who need help in setting up their vaccination. But with this good news, we all still need to continue being vigilant, patient, and caring of others. Continue to protect others and yourself by wearing a mask and limiting close contacts. Thank you.
Thank you, Dr. Mark Wilson. Melissa Arrighi, thank you for joining us once again. What do you have for us?
So the one thing I'd like everybody to remember today is that we can offer assistance for you, both through our senior center and any questions you have. We're trying to get information out regularly. There is an official spot to go to, which is the town's website, the town's Facebook page, but I will always take calls. My office phone is forwarded right to my cell, so I'm happy to hear from a resident anytime. Earlier, Moderator Triffletti got a question for us about the town manager said we don't have a vaccination clinic. Why? We should have one in Plymouth. Why isn't there one? It strictly comes down to the availability of the vaccinations. When those start to become more available, I can assure you this town will be ready, and there will be one either hosted here or hosted locally, and we will be part of that collaborative process. Thanks.
Thank you, Melissa Arrighi. She is the Plymouth Town Manager. We're going to go to Plymouth County District Attorney Timothy Cruz. Tim, lots of good information about the courts and what you're doing. What do you have for us? And unmute yourself, Tim. This is Plymouth County District Attorney Timothy Cruz. Not quite sure.
All right, you got me now, Steve?
We got you now. There you go. Thanks.
Got me. All right. Thanks. Listen, I would just say, like everybody's, this is a very difficult and challenging time for everybody, and we need to remain vigilant regarding what we do, trying to stay healthy and take care of each other, and also at the same time remain vigilant regarding your information, regarding people who want to get your credit card numbers, your social security numbers, your bank accounts, anything like that. Be very careful. And if you have any questions, please feel free to reach out to the Plymouth DA's office, PlymouthDA.com, 508-584-8120. We're here to help you. Like I said, we'll be through this before you know it, hopefully, and we can all continue on and go on and back to our lives. Thank you.
Thank you, Plymouth County District Attorney Timothy Cruz. Michelle Bratti, you are the Director of Elder Affairs for Plymouth. Thanks for taking care of our seniors.
Hey, it's an honor to do so. So they kind of take care of us as well. Final thoughts. I just want people to know that Cal will be mailing to all patrons 75 plus a COVID-19 vaccination fact sheet so that you have the tools you need readily available in your hands, so to speak. Remind you we're here to assist you in any way we can. On another quick note, I do want to tell the people, our community, that the AARP tax program registration at Cal is now filled, and all appointments between February 16th and April 6th are taken. If you would like to be placed on a cancellation wait list, please call Cynthia at 508-830-4230, and she will take your information. I'll leave you with a little quote that's quite appropriate for current times. Patience is the calm acceptance that things can happen in a different order than the one you have in your mind. David G. Allen. Have a great day. Thank you.
Thank you, Michelle Bratti, Director of Elder Affairs. Michael Jackman,
Michelle Bratti,
you are
Director of
our
Elder
federal
Affairs. Michael
partner
Jackman.
at Congressman Keating's office. What should we remember today? Mike.
Yeah, thank you, Steve. It's great to hear from everyone as always, and great to hear that there are new opportunities or emerging opportunities for folks to get vaccine in Plymouth and the surrounding areas. I know there was a question about the federal retail program and the closest site being in Randolph, a CVS in Randolph. The CVS is, my understanding is that the federal retail program is to supplement the state program, and there are, I haven't checked the website recently, but I do believe there are CVS and other retail pharmacies that are closer to Plymouth that are part of the state site. So the idea is that's a separate stream to target underserved areas and to get vaccine opportunities into areas that don't currently have them. But we're going to be monitoring that and looking for new sites to be added all the time. So thank you again for the opportunity, and everyone have a great day.
Thank you, Michael Jackman from Congressman William Keating. Amy Naples, we're into February. The businesses have made it thus far, and you've told us love is in the air. What should we think about?
That's right. We love our small businesses and we want to ensure that they are here forever. And we have a couple of tough months ahead of us. So the Super Bowl is a great opportunity where you can support our local restaurants by ordering some takeout, sit in front of the tube and vote for your favorite team. So as always, I encourage you to support local. I also just want to recognize Michelle Bratti and all her efforts for our seniors. I am a proud member of the Cal, proud board member of the Cal, and I know how much work and everything that she's doing for our seniors. I reached out to her for obvious concerns, and I figured she was being inundated with so many phone calls, but she is handling it like a pro, and it's just so nice that we have her and everyone's able to reach out to her. So keep up the great work, and so nice to see all the panelists today and all their hard work they're doing as well.
Thank you, Amy Naples, Executive Director of Plymouth Area Chamber of Commerce. We now return back to where we began with Plymouth State Representative Matthew Muratore. Matt, lots of good information today. How should we close out?
Yeah, great information, Steve. And, we had our monthly conference call with the governor and lieutenant governor yesterday, and he spent a lot of time telling us the process of how the vaccine rollout with the phase 1, phase 2, and phase 3. And he was a big believer that, in the phase 1 area, it was all the high-risk people, the people that have, were susceptible to dying from this, people that can't get out in congregate living situations, whether it's a long-term care facility or the prison, and the workers that surround us, healthcare workers, et cetera. And then in phase 2, the beginning is those that are still the high category, anyone over the age of 65 and 75, that they have to be the first priorities in this phase. And then it will get to the working group, folks that are, in early childhood and education, teachers and funeral home directors and grocery stores, et cetera. So I think, the rollout may appear to be slow to people, but it will eventually catch up very quickly. As I said last week, we will sometime in March, be one of the top states in giving out the most vaccines. You know, the governor just announced too, Steve, that just came out that there will be 120 new appointments this Thursday that will be opened up. So Thursdays are the key day to go on the website. And 120 now. It used to be around 80 appointments, but as Mike Jackman just indicated, the president has upped the doses. So now we're looking at about 120,000 doses of vaccine, where before we were getting somewhere between 80 and 20. And also he discussed that there'll be more CVS and Walgreens that will be added over the next week or so as well. So the appointments are the 120,000 appointments. 55,000 of those will come from the 5 major sites like Gillette and Fenway Park, and 21,000 will come from CVS and Walgreens. So that's where the majority of the appointments will be. So Thursday is always the key day, Steve. You know, and I want to just end with what Michelle had to say, and terrific job what she's doing, you know, taking care of the seniors and getting the proper information to them. But it is all about patients. As I said before, it's a supply and demand issue. We all need to have patience. Everyone will get their dose, and first dose and second. Somebody has to be first, somebody has to be last. So this is the order that we decided to go through with the state. And I want to close with something the governor said at the State address last week. He quoted Walt Whitman. And, you know, we're getting a lot of calls. I know Melissa is, I know Michelle is, and Mike Jackman, and, you know, any elected official or appointed official, they're getting a lot of calls. And, you know, why can't we get our vaccine? Why can't we do this? Why, you know, and there's a lot of people who are not really patient. And I would caution people that Walt Whitman said, be curious, not judgmental. Ask the question, ask why, not how can I. We'll see you next week, Steve.
Thank you, and that's Plymouth State Representative Matthew Muratore. Thanks to all the members of our panel. We will be back next week on Wednesday at noon for show number 85. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.